Hello, YouTube family. It's me, and it's John.
Hello.
He does still exist.
Hello.
We wanted to give you an update of today's appointment.
Yes.
He was actually
and
able
I
to go.
went.
You did, finally.
And there were other men there. Freaked me out a little.
They were just with their
I know, they were just with their wives, but it still was a little odd. Because on the collection day, actually, I don't know if I saw any guys that day either. It's in and out. But today, I don't know, it's kind of funny. The first guy was like all perturbed. She's like, "You want to come back with me?" And he's like, "I'd rather play on my phone."
No, he wanted to go back.
No, he wanted him to go back, but he was like,
no, well then it was the other couple. No, it was that couple.
No, it was like the Asian girl and the...
I know, he wanted to go, and she's like,
go.
Can I go? Can I go? And she's like, I don't care. She didn't care whether he went.
He didn't care.
He wanted to go.
I don't know.
He wanted to go.
I thought it was kind of a jerk.
He wanted to go. He's got it backwards.
And everyone gave me the stink eye.
For what?
All the women were giving me the stink eye because I was sitting in one of the chairs.
Ah, they're dumb.
You can't sit in one of the lab chairs. I was going to get punched out.
You were with me. You got a free pass.
Not when she went back for labs. Because then I was sitting out there and people were looking at me like I was some kind of creeper.
Well, maybe they thought you could have been a woman looking like a man needing blood work.
That's probably what they thought.
Okay. Well, we will give you a quick update.
And I was there for the ultrasound.
Yes, and I have video, a little bit of video of it. I may or may not upload it, attach it to this one. That you can obviously tell the follicles are bigger. And the actual doctor is in there in this video.
And I asked her a lot of questions, and she actually had some great answers.
Yes, you'll hear that in the background if I post it. Anyway.
About implantation, and what to do about implantation, and why they check the uterine wall, and what to do if it's not optimal. And, you know, sometimes they just harvest, and other times they implant, so it's kind of interesting.
And I asked her about pre-implantation diagnosis testing, which is something we were going to be doing. And that will be another video by itself. Okay. Anyway, my estrogen level today...
I'm not invited.
Well, I'm just going to rant about what
I know.
happened.
Look, I work for the government. And we're not the most efficient.
She's not. That's private practice.
I know. That's why. It's like, come on. I mean, you expect that with where I work, but
not in
private practice.
Well, I'll tell you.
For private pay patients, mother of pearl.
Whew.
Anyway, separate video.
Okay, today they checked estrogen, progesterone. My estrogen level is 277, 3.79.
Holy moly. Insanity. It was bad at 600. Okay, here's the thing.
Male perspective.
There is craziness. They give all these medicines. They should either do A, give her some sort of Ativan or Xanax combination. Give it to me so I can be zonked out when she's yelling at me for no real reason. Or have, like, God forbid, a male support group. Maybe even a free pass to go get drinks somewhere. Would that be so wrong? There's no support for the partner. Why don't you treat the whole patient?
The whole family.
I mean, WT. The whole family. What about this medical home concept? Come on now. I mean, the punishment, the irrationality. I mean, I'm not perfect, but it ain't right. And now the estrogen's 2,700. Let me tell you.
Yep.
It's not enough alcohol, I'm telling you.
Okay.
Bad. I feel for you brothers out there. I feel for you. Give me that. A little bit of that action. All right? Fist bump me.
Okay. All right, can I go?
I'm doing it again. Yeah. Get the guy in the back.
My progesterone level is 0.97. My endothelial thickness is 12.35.
Looks good.
It's thick where she wants it to be. On the left ovary, we have 6 follicles that are between the sizes of 10 and 13.
Do other people give all these details?
I don't know. I'm giving them.
Okay.
Education is key. The right ovary has 8 follicles that are between 10 and 14.
Here's a helpful tip. Best time to ask the doctor questions is when they're doing the ultrasound, because they can't get away and they're not thinking about the next appointment. They're just thinking about your exam. Great time to corner them.
I agree.
Helpful hint.
I go back on April 14th, which is Monday at 9. They'll do some more lab and check these out so we can figure out when we're going to be giving the trigger shot. Medications are still the same. The only addition is on Sunday morning. I will be starting the Ganirelix, 250 micrograms, sub-Q in the morning. And I don't honestly remember what that's for. I'm going to have to look it up because I don't believe we took that with our last cycle.
It's a lookup.
Yeah, it's a lookup.
It's a lookup type situation.
And I think that's it.
Yep. Thank you for tuning in.
Yes, thank you. And hang in there.
Hang in there. We're hanging in there.
We're trying.
And talk to me, brothers. If you want to have a separate video support group, I'm all in. All right? A little bit of that action. That's what I'm talking about.
Are you done?
That's it for me.
Okay. Have a great weekend, guys.
Have a great weekend.
I want to make sure it's okay with you.
Yep, absolutely.
Thank you. I don't know if you've officially met my husband.
I don't think so.
This is
Hi.
I'm John Lyon.
Nice to meet
Nice to meet you also.
you. All right, let's.
Thank you for coming in on a Saturday.
Oh, we are always this kind of work, you know. I think Dr. Pro and I just rotate back and forth and. Yeah, let's we're gonna zoom just a little bit so we can catch those just nicely. Okay, so this is right ovary, and we're gonna start getting some follicle measurements here, my dear.
What did you think of the uterine lining?
I think that really until we get to the point of trigger, you're just trying to get a thickness. And right now I think that thickness looks really good. So we're going to keep kind of watching that and see how it goes. Ever so often they just don't develop in the way that you want them to. And when that happens, we still retrieve the eggs, we still get fertilization, and then we freeze the embryos and hold off and come back and build a new lining.
I see.
Without the extra FSH and all that kind of stuff in the system. So there are kind of different methods.
Sense.
Yeah, different methods. So right now it looks like I would want it to look, but I'll tell you, sometimes as you get very close to trigger date, you can start getting a little fluid in the cavity, you can get all sorts of different things, and the data is pretty clear that if there's fluid in the cavity, we need to not move forward. It really doesn't matter. They used to, we would used to put a little catheter in and withdraw the fluid. Even on the last scan, yeah, you would think, and so, but lots of studies were done trying to remove that fluid and see if it was just fluid issue. But I think what we realize from all the studies that have been done now is that when we have that kind of fluid in there, the lining is not expressing the cell adhesion molecules really that need to be expressed to get that connection, between embryo, and so the lining's telling us something at that point, you know. So,
We've had issues with implantation.
Yes.
Is there anything that can be done to optimize that?
So implantation. Yeah, in terms of the acceptable treatment at this point from just the reproductive endocrine literature, the sorts of things that we think about first of all, trying to diagnose an implantation defect is quite challenging because a lot of times it's called an implantation defect when truly it's a genetic issue with the egg. And because PGD or PGS, pre-implantation genetic screen, wasn't done, you know, people are making the assumption that those embryos are genetically normal, and that's why, and that there was something wrong with the lining, which is why it didn't implant. 90+% of the time, your uterus is not your problem. It's really the egg or the sperm, how it fertilized, right? And so, let me get this over. And so when, and I have some patients in my practice that I truly feel like they have implantation issues.